The Institute for Healthcare Consumerism, and welcome to today's IHC University webinar program. Appreciate everyone joining us. We're going to wait just a minute or two for other attendees to come on, and then we'll start our presentation. Again, thank you for attending.
Push over here.
Again, good afternoon. This is Doug Field, the CEO of Institute for Healthcare Consumerism, and we appreciate you joining us for today's webinar program entitled A Patient-Centered Organization. We appreciate our sponsorship by Aflac and allowing us to bring this program to you. Today, Ron Bachman, who's our chairman of our editorial advisory board and one of the leading thought leaders on healthcare consumerism and CEO of Healthcare Visions, will be leading today's program. He will not only touch on the 5 different stages of healthcare consumerism, but he'll also talk about the impact of exchanges going forward and what this means to the area of supplemental health benefits as well. So without further ado, I'd like to introduce Ron Bachman again as your presenter today. Ron?
Thank you, Doug. I appreciate it, and thanks to everybody who's joining us today. I want to start off with the idea that what we're talking about is making changes. Approach to thinking about making changes because we got so much going on in the healthcare industry and around healthcare consumerism. And I like to explain it this way, that you have to have 3 things occur in order to create real change. You have to have a desire for change, you have to have a vision, and you have to have a process to get there. And then you can create real positive change if you have all those things. If you don't have a desire for change, then we can talk and have a great academic discussion and create a vision for you. Hopefully the people on the call today really have a desire to make some changes and get involved so that your desire for change, your understanding and getting involved with different alternatives and options gives you some vision and a roadmap. And there are plenty of vendors out there, many of whom may be even on the call, that will help anybody get and accomplish those visions. Before I get into the full presentation here, I want to everybody recognize that, in fact, there's going to be a lot of material here, some of which I'll go through fairly rapidly, so I'm not going to go. Slides will be available to you, so you can go back and you can look at and study for those who want to get more refreshed on some of the ideas. But I want to be sure that the information's there, even if we didn't have as much time as might be necessary to go through them all in detail. So I'll apologize in advance if we skip through a couple slides fairly quickly. I wanted to start off with this slide here of talking about the distribution of healthcare enrollment. Some of you may have seen this. The These kinds of studies and information are out. This is from the Kaiser Family Foundation. And you can see on the far right side the gray areas of this slide where the account-based type plans have been growing very rapidly, as all of us know who have been involved in this industry. And they've been growing pretty much at the expense of fewer traditional PPO plans, HMO plans as well. So this is a growing industry, and it's expected to grow well beyond where it is today. But that's why we've given so much emphasis to this at the Institute for Healthcare Consumerism. Now, why is this happening, and why do we expect it to continue? Well, I like to follow the idea of megatrend. So powerful that the direction of change cannot be stopped. Federal laws can speed up or slow down megatrend forces, but like dam rivers, megatrends will redirect themselves to achieve the inevitable result. And I believe consumerism is one such trend. Around us, not just in healthcare, but we can see them in so many other areas as an example of why consumerism is such a powerful force. Americans want control. They bank electronically, buy and sell goods through eBay, and on down that list. The implications for healthcare is people really don't want limits, restrictions, waiting lines, or other barriers to their healthcare. In terms of healthcare consumerism, it's really starting to feed its way into so many parts of the industry, and with recommendations to management, regardless of whether you're in healthcare or in other areas. A couple quotes here worth reading through. The Deloitte Center for Health Solutions says, health policy experts and economists have reasoned that costs could be lower, services better, and quality substantially improved if the industry repositioned itself as a consumer market. PwC has this quote, seeing things from a consumer's perspective, outside in, and making that view the core of your strategy may be the most important thing that sets you apart from competitors. Companies that design this kind of metrics, an integrated approach, a thorough understanding of the consumer, and strategic investments can reap real dividends. Now, in particular, this last one from Price directly. Notice that's a comment that they're trying to feed out as one of the big four accounting firms to all of their clients in all the industries, that people really need to step back and look at how they're doing business from the consumer's perspective. That's what the Institute's been talking about for a long time around the healthcare issues. Well, let's talk about growth of account-based plans. Now, we've also been very clear that healthcare consumerism is not just about account-based plans. It's about the many different ways in healthcare decisions. But let's talk about the growth of healthcare, since that's sort of been the core and the beginning of this whole development of consumerism. And I won't go through all these bullet points, but let me highlight a few of them. The 2012 Kaiser Family Foundation report showed 31% of firms with health benefits offer an account-based plan using either a health reimbursement arrangement or a health savings account. On a couple bullets to the American Health Insurance Plan report. In the 2012 AHIP, American Health Insurance Plan report, health plan coverage rose to more than 13.5 million, up from 11.4 million in 2011. So we continue to see a rapid growth in the use of account-based plans, in this case just the HSAs. That doesn't even include health reimbursement arrangements. And the most recent report on the bottom there in 2013, Towers-Watson study, shows HSA reimbursement arrangement plans are offered by firms. So it's widely accepted across the spectrum of firms. Full replacement, where that's the only option that's available, went from 7.6% in 2010 to 15% in 2012. And it's expected to increase to 25% in 2014. So rapid growth in account-based plans. Well, let's define healthcare consumerism, because I don't think there's a standard industry definition of it, but at the Institute for Healthcare Consumerism, we've adopted this definition. Healthcare consumerism is about transforming a health one that puts economic purchasing power and decision-making in the hands of participants. It's about supplying the information and decision support tools they need, along with financial incentives, rewards, and other benefits that encourage personal involvement in altering health and healthcare purchasing behaviors. A couple of keywords that are there and a couple of keywords that are not there. In particular, the keywords that we're talking about health and healthcare. And the words that aren't there, you'll notice there's nothing directly about the type of plan design. It says nothing about account-based plans. It's much broader than that. We think of healthcare consumerism as being an overarching strategy, approach, contribution, with account-based plans being a very significant. Lots of different ways that you can build healthcare consumerism into your program outside of the account-based plans. And here's an example. The healthcare consumerism is much more. There are different ways to reward and incentivize people. Besides using accounts, you could change employee contributions. You can reduce their cost sharing. You could add additional benefits, give gift cards, trinkets, vacation time off, or even comp time. So there's lots of different ways to align the incentives of getting people to do the things that will be both healthy for them and good for your overall organization. There are two basic principles of healthcare consumerism that I like to highlight. First of all, these programs must work for the sickest members as well as the healthy. You know, the early versions, the early generations of healthcare consumerism, the account-based plans, were criticized as being only for the young and healthy, the wealthy. And it really can't be that. If it's only that, then it's not a very successful program, and it really can't be considered to be a megatrend if it's that narrow. So it really must work for the sickest as well as the healthy among us. And I think the newer generations, as we'll see in a few minutes, when we look at the generational approach to thinking about healthcare consumerism, will show that clearly healthcare consumerism has matured, where it in fact does do an excellent job, if not the best job possible, much better than what we used to do for those who are the sickest among us to try to stabilize them or to get them healthier. The second basic, for those wanting to get involved in decision making, as well as those techies who will get on the internet and find out what's the cheapest drug or what's the cheapest place to get their MRI. You know, the reality is that we think of healthcare consumerism as being sure people have choices. And if you're involved with other issues that you don't have the time to get on board and on the internet and condition or a cheaper drug or a doctor choice that you might want to go to, you may be involved with a family issue, taking care of a loved one who's sick. You may have a big job opportunity. It's $1 million sale that was much more important for your time and effort. In this case, what we're saying here is under the basic principles, if that's the case, you may wind up paying more under healthcare consumerism. You had searched out the cheapest options or the best options for you. But the reality is that there is a maximum out of pocket so that you're not going to lose your home, you're not going to go bankrupt, you're not going to lose your kids' educational funds, that it's going to work for you whether you want to get involved or not. You will just do better if you are able to get involved, but you're not going to be suffered so much that you're going to be hurting financially if you don't have the time or effort to get involved in some of the detailed choices of care that you might otherwise access. Let's build on it here for a second, and at the Institute for Healthcare Consumerism, we consider 5 generations. This is not an academic or think tank model. This is what we see actually happening in the real world, that there are vendors, there are suppliers, there are employers that are taking advantage of aspects of each of these generations. Now, for the most part, I think that we are sort of in the middle of the second generation. Even though we have 5 generations here, we're going to sort of see where we're going by some of the early adopters that have products and services of value in those later generations. But for the most part, we're still sort of stuck in the second generation, working our way through the technology issues and trying to implement a focus on behavioral change. Just to highlight the generations quickly, and then we'll get more detail later on. Generation were just purely high deductible plans. And in fact, we're subject to some of those criticisms that it was only good for the young and healthy and wealthy. As we moved into second generation, we started really focusing on behavioral change, rewards and incentives, both for those people who are healthy to stay healthy, but for those people who are sick, have a chronic and persistent condition, and we want to stabilize the condition. We want to help them follow the doctor's orders, change their lifestyle, do the things that can help them be less costly even though they have a chronic condition. If it's chronic and persistent, you're not going to cure it necessarily, but you can stabilize it. A stabilized diabetic, as an example, has a dramatically lower annual cost than somebody who is not stabilized and is readmitted to the hospital, has to have a things that can happen from diabetes, dramatically different if they're following the doctor's orders and taking care of themselves. The third generation is about health and performance. That's about how does your health care, if you're doing the right things, affect your employment and your company's bottom line. How productive are you if you're healthier, and how does that help your organization? It also talks about how a corporate environment and culture can affect the employees' choices and options for their health care. So it's an interactive way between to look, but it allows for the cost of health care to take on a slightly different perspective. In this case, the cost of health care isn't just the line item, the budget item in the HR department. It's how does what I do in the HR department affect, so that there is a much broader impact and analysis that's necessary to see what the value is of adding or taking away any particular benefit, and how some of the other aspects of your organization can affect your health care. The fourth generation is very personalized and individualized. It's about genomics. It's about personalized healthcare devices that we're going to be seeing, that we're all going to be wearing, or that we're already personalized health and healthcare issues. So it's not about a broad population management. It's about very individualized health and healthcare. It's not about regional analysis of the probabilities of being sick or being cured by a given your own circumstances as you as an individual. So it's a very personalized health and healthcare concept. And then we'll talk about the fifth generation, which I call community health and healthcare. That is, how do we take it beyond just looking at ourselves and looking at a much broader population? How do I help my neighbor? How does my neighbor help me? How do we work together? How do I find the doctor's office by sharing information as we do with social media and such? So there's a number of things in the fifth generation. This particular presentation, we're going to focus mainly on the third and the fifth generation because we just don't have time to go into the others, but you'll see some insights to the others in just a few minutes. In terms of what I call the promises of consumerism, there are 5 major building accounts. That would be your health reimbursement arrangements, your health savings accounts in particular. Health management, keeping people healthy who are already healthy, keeping them from having chronic conditions or having an acute management. Health literacy, some would call that transparency, understanding, decision support tools, all those sorts of dimensions of health literacy. And then incentives and rewards. And I think of incentives and rewards as an incentive is something that you put up front to encourage somebody to do something, whereas rewards is something you do at the back end after they've completed or finished or met some standard. These are 5 standards. Some of you have a 6th standard or a 7th standard, but I think this kind of covers the waterfront and what we're going to use for this presentation. Now, if you put these together, you can sort of get to what I call the crystal ball of consumerism. Here I've identified it as the Consumerism Grid. You can take those 5 generations that we talked about and the 5 key building blocks. And if you make the grid out of it, you can almost go across or down on any of them and get a high-level indication of, in fact, what is going to be happening or what's developing in the marketplace. Again, this isn't an academic or think tank model. We see these actual services being developed and produced out there. In fact, a presentation like this about 2 years ago would have only had 4 generations. And people kept asking me, what's the 5th generation? I said, I don't know until we actually see the market to establish the idea of a 5th generation. And then we started to see a number of the activities which we'll describe in the 5th generation develop, be offered, and taken up by many employers. So we added that about 1.5 to 2 years ago. Now, of all these different areas, you'll see at the bottom here, I've identified what I think are the weakest areas in this whole movement, this whole megatrend movement of healthcare consumerism. And that is around health literacy and rewards and incentives, but in particular the health literacy. A great deal more needs to get done. a lot is being done and a lot is being developed on how do we best communicate to our staff, the employees, how do we best communicate both upline as well to management around the benefits that we're putting together and how we encourage good health and healthcare decision making by the individual patients and by our employees to keep themselves healthy and productive from a work standpoint. I think we're seeing a lot there, but I still think of all these, it's the weakest area. And the rewards and incentives, again, we're following our own evolution in rewards and incentives from providing rewards and incentives around participation in programs, completion of programs, and now we're really using outcomes and health status, actually, which is a part of and is being expanded under the significant incentive for biometrics, things like blood pressure, cholesterol, nicotine use, body mass index, waist size. So we're seeing the rewards incentives category actually follow its own pattern of evolution towards the things that are more successful than others. And every employer is going to be at a different level. And you can't always jump into the health status areas. Many employers will start with something less intrusive or more encouraging to employees and then work their way through. But since this has been around for a while, we're clearly seeing more and more employers start to move towards the use of biometrics and the incentives based on health status. On the second generation, I'll touch on that a little bit since that's where we are. Personal care accounts are no longer in the second generation just a high deductible plan with an initial account. Now we're actually able to add to that account. So it's not about that decision around the kitchen table in October, November, December on enrollment, what plan do I want? But in fact, your plan changes throughout the year based upon the decisions that you make. The decisions to comply with certain standards, to keep your biometrics in the right categories, but you can have any initial during the year so that you really don't have a high deductible health plan. And I don't like that term, but we're kind of stuck with it because it's actually part of the law for HSAs. But if you have the proper rewards and incentives available to employees and they're taking advantage of those throughout the year, you could actually fill up that deductible and have a zero cost sharing in theory for employees if your programs are that significant. As we work our way down here, again, I'm not going to have time to go through all these different categories, but the idea of second generation is we're providing more rewards and incentives to encourage good behaviors, a concept that we're typically American. We want to get paid to do the right thing. You know, if that wasn't the case, we wouldn't have as many smokers as we have today because they know that's not good for their health. We should change. We wouldn't have the rampant growth of diabetics in this country and obesity. So we know that just good health isn't enough, and rewards and incentives and information are the key to actually encouraging and engaging more people of your population. I want to mention the very bottom one is the focusing on for a second under the across on the rewards line, and that's what I call health incentive accounts. And this shows that not only is this about HSAs or HRAs, but you could set up a health incentive account on any account. You know, with the health savings account, you have to have a specifically designed HSA eligible plan. But with a health incentive account, you can attach that to any kind of plan design because almost nobody in the country has got 100% for everything. There's always going to be some cost sharing. And if you want to encourage employees, and you can cover those cost sharing aspects with what I call a health incentive account, which is really just a specialized health reimbursement arrangement. It just starts off with zero. You don't have any money in the health incentive account, but then you build it up based upon the incentives that you provide within your program. It can be a very powerful tool, and for those people who don't want to go to a high deductible plan right away, or maybe a health incentive account to your existing plan, and that would provide funds to cover the deductibles and copay. And if you don't have significant deductibles and copay, if you're one of the few out there under HRAs for any healthcare expense, including vision, dental, and other supplemental benefits. So it can be a very powerful tool to help employees access other types of benefits and care that they're looking for. Now, why is it so important? Well, many of you may have seen this chart here. This is for a number of years where they did some significant studies and said that 50% health is behavioral related. It's not access to care. It's not your genetics. It's not even your environment. It's the behaviors, the decisions that you make, the choices that you make. So if we can focus in on this behavioral change in the second generation, there's obviously a lot of room to impact cost and the health status of individuals in a positive way. Again, a very busy chart here. I'm going to skip through this a little bit, but the point here is that for every health status, whether it's well, acute condition, chronic condition, or even catastrophic, today we have lots of services and more developed around these, and you've got different vendors and suppliers out there in each of these categories, some specializing in one or more of them, some doing all of them. But when I use the term in this presentation of wellness, I'm talking about people who are generally healthy, and how do you keep them healthy? When I use condition management or disease management, I'm talking about people with chronic and persistent conditions and stabilized wellness to mean both of those, but I want to differentiate those two categories in particular. So lots of programs currently available. We already mentioned rewards, and we're working our way from, if you will, the top down, and we have more and more organizations providing rewards based upon outcomes and health status. Some backup support for all this. Quest Diagnostic reports 60% of employees who participate in wellness programs report that the incentives have been so successful that increasing participation that approximately 2/3 of employers who invest in employee wellness use an incentive to drive employee participation. And again, you can see the list of biometrics on that chart. Let's talk about third generation, because we're seeing more and more folks move from second generation, where I think to a large degree we're still sort of in the middle of that as technology is identifying how we monitor, how we collect information on compliance, and how we reward people, how we do it systematically. But in third generation, we begin to move to the corporate bottom line. And so I'll take, again, a couple of items here to focus on to save time for the full presentation. But let's take health management as an example. Here are some of the things we're seeing significantly develop around the country. Worksite wellness, focus on safety, not just on health and healthcare, but on safety, on-site clinics, real emphasis on stress and error reduction. I'm going to in stress in the workplace and how that it's really a big effect on corporate productivity and the bottom line profitability of any organization. But again, you can work your way down in any of these 5 building blocks and see what's developing in a number of areas that are actually out there in the marketplace today. We're seeing a pretty significant draw into this third generation as corporations are realizing how important health and healthcare is to their organizational bottom line. And the reason generation is gaining some momentum is because many employers are realizing this concept. They may have thought about it before in some ways, but I think it's becoming more ingrained in their thinking that health insurance on an employer's human capital. They need to maintain that to get people to work on the job. And if they're doing the healthy things, you have fewer unscheduled sick days, you have fewer disabilities, you have more productivity. A number of very positive things come out. And the concern of many is, you know, they don't want to give up this to a government program because, you know, it's important not just for as an extra benefit by an employer, but it's really critical to the productive, profitable organization. I mentioned stress and depression as being a critical part of this third generation concept. And here's some real facts around there, that stress is 21.5% of total healthcare costs. It actually, if you do any analysis, and there's been several studies done by Dow Chemical, as it was done a few years ago, and a number since then, that showed that actually, if you take a look at the major drivers of your healthcare costs, you're going to find stress and depression probably being the #1 highest cost, not just the cost of depression by your mental health benefits, but the way it feeds into so many other areas that if it's not treated properly, whether it's digestive disorders, whether it's hypertension, you can't treat a diabetic who's stressed and depressed and they're not taking their medication until you treat that underlying depression. 40% of primary reasons that employees leave a company, 50% of presenteeism, and maybe the term should be impaired presenteeism. They're on the job, they're not thinking about it because they're stressed and depressed from something that's going on at home or with their own lives. Stress is 33% of all disability and workers' comp claims, and 50% of the reasons that employees take unscheduled absence days. So big impact on the corporate bottom line in these areas. This is the second, I think, most important chart over that healthcare grid, or that crystal ball I mentioned earlier, and that's this own analysis of stress and management on corporate costs. And I'm going to walk through this a little bit. The medical intensity of the mental illness goes from low, medium, high, catastrophic, and here's a list of conditions that would fit into that spectrum. Leading national psychologists and psychiatrists. You start off with frustration, anxiety, low stress, and depression, and you work way all the way down to some of the more sophisticated, if you will, mental health conditions of schizophrenia, bipolar, obsessive compulsive. Now, the direct mental health costs of these increases, but they're not enormously high in any of these categories relative to your normal healthcare costs. But if you go to the next column, it talks about the comorbid conditions, where you'll find mental health associated with other healthcare conditions. Think about with low stress and minor depression, tobacco use, which we know drives up healthcare costs, sleeplessness, create the impaired presenteeism. Colds and flus are more frequent. Your blood pressure is up. You work your way down a little bit more that you have some of these conditions, and stress is going to exhibit itself somewhere in your body. Hypertension, musculoskeletal, digestive, gastrointestinal, and we treat all these and cover these under the healthcare plan. But if we don't deal with any underlying stress and depression, those costs are going to just get even greater. Now, there's an indirect corporate cost item, but the final column is about the indirect corporate costs. The increased errors, the lack of being there on the job, that presenteeism, loss of teaming, unscheduled absences, poor morale, relationship conflicts, lost productivity, working its way down, divorce, turnover, early retirement, all the way down to death, workplace violence, and disaster recovery. Think about that classic story of somebody walking into the post office and shooting them up. We even had an event yesterday here in Atlanta, or the day before in Atlanta, where you have the kids, somebody coming into school, and the kids, you have death in the schools from people who are suffering from mental illness. Well, if you have that on the job, think about somebody who has access to your computer systems. They shut them down. You have to have disaster recovery to replace what's been lost. All sorts of things can happen at the workplace if you're not dealing with the mental health issues properly. Let's skip over to the fifth generation. Again, I've got all the other generations on here, but let me skip over the fifth generation and talk about it, because this is where we see some leading edge companies, some early adopters getting involved. Generations, keep in mind, don't replace the prior generations. Typically, they will add to, and you'll have products and services and designs in your program that are part of all of these generations at any given time. But as a whole, we'll sort of work our way down iteratively with what the vendors offer and what your employees are comfortable with using and what you're comfortable with offering them. So we'll work our way down iteratively as these things progress and become more recognized, and we find the most successful ways to implement these. But let's take the personal care accounts. At some point, we have to move beyond getting paid, because anybody who's had psychology, he knows that you can only pay people so much and keep increasing that to get their attention and the reward incentivize them. At some point, rewards and incentives have to go from being extrinsic support to being intrinsic. We do the right things because of the right things to do. When we start to do that, we'll start to develop new ways to establish personal care accounts. It may be volunteer, what I call volunteer vessels, pay forward, or charity. Many things like frequent flyer, where people accumulate frequent flyer points, and then they give them to organizations to use for kids that need, for instance, that Make-A-Wish kind of foundation support. So it's things that you can share with others, not just doing it in a financial way. The bottom area on rewards and incentives, again, we go to more psychic rewards, recognition, honor, respect, and even the word love I put in here. These are things that have to come out after we sort of work our way through these initial years where we have to actually pay people to do the right things and get their attention. After a while, they'll do it because it's the right thing to do. Now, some of the other areas that I really like in here where we had said are the weakest areas of consumerism, I think take on some new perspective. Under health literacy, as an example, going across that line, I really like in here. Friendship pods, wise men and wise women, sharing circles. We know from experience in dealing with alcohol, drug abuse, weight loss, that being together and talking to other people who are facing similar situations can be very supportive in getting things done. So getting that circle of people around you that can support what you're doing, whether it's family members knowing your circumstances and being supportive, or it's other very powerful, encouraging tool. The friendship pods, people who are like-minded, have the same basic interests, whether you're a runner or a walker, whether you're who have a similar set of basic principles and lifestyle interests, can be very strongly influential on you maintaining those active and appropriate lifestyle changes that you need. So this really gets into a lot of areas of social networking and sharing. Other areas that I would mention before I go on here is along the lines of health management, the second line going across. If you go over to the fifth generation, one of the big concept changes here is moving from health to longevity to productive longevity. How do we live longer and be productive so that when we're at an older age, that we're not, you know, this sliding scale of health, that we're actually, you know, getting worse each year, that in fact the ultimate scale for growing old is that you stay fairly active and productive and with an active mind, and, you know, we're all going to, you know, die at some point, but you hope that that's more of a cliff than it is sort of a slide all the way down. That's what the fifth generation much as the other generations, but also how we take that active employee experience, those support functions, the knowledge that we learn in dealing with our health as active employees, and can take it on even retirement years. Now, in the fifth generation here, to show how some of this is really developing in social media, PricewaterhouseCoopers, a third of consumers had used some form of social media for health purposes. So I draw the conclusion a little bit from that and other sources that that self-absorbed me generation that I'm really a part of in my birth years, way back when, but we're still around. The me generation is giving way to sharing communities on Facebook and Picasa and LinkedIn, Plaxo and YouTube. So we're getting much more interactive with the technology that's available to us today. Here's a list, some of which we've already covered, that it moves from personalized to community, it moves from health to productive longevity, it moves from self-help to helping others, from being served to sharing, and you can read down the list as well. The term consumerism has always troubled me a little bit because it's not just about putting all the burden on the consumer. Everybody has got a new role to play. That shows the change from traditional managed care, PPO, to healthcare consumerism. And we all have a different role to play. The focus is more on the demand side, for example, in consumerism, than on the supply side for traditional. So it's necessary, you're not sick enough, and you get delays and denials for your care. We're on the demand side. The consumers are more in control, and it's how do you control the demand? You don't ask for services when you're paying more of the bill. Get rewards and incentives for doing the right thing. So it's really a shift from the supply side to a demand side. Let me just pick out one or more here, and then we'll move on. On the employee side, clearly under the traditional, they feel entitled. They need to get care. They're passive users of the service because it's all available to them. They don't have to do a whole lot. Whereas healthcare consumerism, clearly they have to be informed and more engaged in their healthcare. On the provider side, providers in the past were in many ways restricted. They had to do certain things and not do other things. There were coverages that were provided in some plans and weren't provided in other plans, so they were also confused. What's the standard of practice? What's going to be allowed by one insurance company versus for the provider side? On the consumer side, we've been using this term accountable very frequently because of the Affordable Care Act and accountable care organizations that were defined under that. So now the providers are really what I would call accountable caregivers. They have to be consistent and well aligned with the consumer. Let me skip through the next couple charts a little bit, and just on this, the key issue here is at the very top line, that under traditional PPO, there's a misalignment between the patient and the provider in terms of financial alignment for incentives for what each should be doing, the information, and the restriction on coverage. In fact, in this world, many of the providers' relationships with insurance carriers is very adversarial. The first thing that's done is negotiated lower rates. So here's sort of a picture of where the traditional is relative to the different programs that we have mentioned in the building blocks. And they're pushing those towards the consumer, trying to make sure the consumer is aware of them or that the benefits are provided. The third-party administrator, the insurer, has got all the rules and regulations on how this stuff is going to be implemented. And then you got the providers out here on the far right-hand side that aren't necessarily directly related to the consumer, except when the consumer shows up as a patient with all these guidelines and restrictions that are put on by either the employer or the third-party administrator, and the providers are confusing. So if a provider says, well, gee, you really need to have this kind of care treatment or trying to counsel them, that may be different than the information that's being provided on some website by the insurance company or made available by the employer. In terms of incentives, there may be some pay for compliance, and so it winds up being very confusing between the provider and the patient. So here's the opportunity to leapfrog the marketplace. I think this is where we're moving, and we're seeing a little bit of movement in this direction as we talk about accountable care organizations become much more linked, and the conflicts going through a third-party administrator get minimized. The third-party administrators, they're just a process, but the real standards on how care is treated and how things are developed are really worked out more closely between the employer and the provider doing the things to get the patient care. That's much more of a patient focus. And I think any programs that we look at going forward, ship or not, is it a focus on the patient provider, or are we putting more restrictions, guidelines, limitations, rules and regulations around the use of various services on the patient? And so it's not just about consumerism anymore in terms of the way we've even talked about it historically. It's about consumerism in terms of how does it improve the patient-provider relationship. So I would encourage you to go back and look at these last two charts here and see the significant difference that can be developed, whether you're putting in a wellness program, a disease management program, information, incentives, etc. There's different ways to do that that encourage this relationship and create a better alignment. So your program really should be focusing on 100% consumerism, not just as an option under one plan design, but in all your plans, whether they're high deductible or not, you can build in healthcare consumerism. Next few charts I'm going to go through very rapidly. It's the financial aspects of the value of all this. It's clearly been shown over and over again, even by, and I'm a member of the American Academy of Actuaries, but the industry wasn't paid by self-serving vendors, and it shows significant savings, even the first year, 12 to 20%. About half the trend rate, 3 to 5% savings ongoing, and it really didn't generate cost shifting. It created better access to health care because more people did preventive care services, and the providers and the patients were more aligned. Let me skip through a few more here and get down to some final charts. So how will healthcare consumerism now fit into this new developing world of public and private exchanges? I want to spend just a couple of charts on this now that we've gone through some of the key aspects of healthcare consumerism. And we're going to have a lot of other presentations in the future on exchanges, so I'm not intending this part of the presentation to be a full explanation of the public or private exchanges. Those are fantastic areas that are developing big changes. We're going to have specialized, focused webinars in the future on those. not going to be available through the public exchange because they're not in the Affordable Care Act. So private exchange is going to have a different perspective to the distribution of products, the sale of products, and giving choices to individual consumers who want some of the supplemental products that may not otherwise be available currently through their employer. And why is that important? Well, here's a final chart. And I call it PHIX because all the confusion about exchanges. That's the PHIX in my language stands for a private health insurance exchange. Sometimes they're called marketplaces these days, but HIX. And here's the voluntary products. The employers that are offering supplemental products today: accident insurance 43%, cancer, critical illness 38%, auto and homeowners insurance only 3%. But employees who want more benefits, and we see this by size of group, and it's fairly consistent. There's not that much variation even by size of group. They want more choices for benefits, especially if they have a high deductible plan and want to help fill that in with a supplemental product. So there's a tremendous opportunity in the supplemental business, which is why I suppose AFLAC wanted this full message to get out and has been a sponsor of this, because they really have a tremendous opportunity. Choices to fill in some of those deductibles or have other coverages that they would like, because now they're going to be in the driver's seat. They're not going to get just what their employer allows them to get. Under the private dollars in many ways to buy with the products that best fit their needs, including many supplemental products. So here's the summary, then I'd wrap this all up. The healthcare consumerism, it may not be a silver bullet for all health and healthcare problems facing the country, but it's a darn good start. There's much more that can be done, especially with the new generation programs, expand.
And available for your access as early as Monday morning. So please submit your questions online, if you would, please. And if you got some questions, and we'd love to spend time answering them. Ron, you talked a little bit about supplemental benefits, and I read an interesting report yesterday that talked about, the top 5 supplemental benefits being life, disability, vision, dental, and accident, as you pointed out. Right. I think you're right. I mean, all indications appears to be that when it comes to consumerism and choice, the supplemental health benefits are going to really rise over the next year or two through these private exchanges.
I think there's a great opportunity. I think that it's going to be an interesting experiment because healthcare costs, unfortunately, continue to rise, which in other areas of your life. So right now, a lot of people are stretched thin. And it's tough for them to buy additional products. But as the economy improves, as the healthcare choices are allowed, people can spend less money on some parts of healthcare coverage and more in other areas. And those who, they'll now have more of a choice to do that through the exchanges. They'll have more information about it. They'll see how it fits in. And so I think there's a great opportunity. And we'll see over the next year or two how this develops and how it's promoted and supported through the exchanges. I think the other area is that I think we're going to the exchange operators promote these products a little bit more than they have in the past because there is that capacity in the marketplace for more purchases.
That's very interesting. What do you see as the, I got a question here, what do you see as the biggest challenge facing employers and their healthcare consumerism initiatives?
Well, the ACA is requiring, in many cases, a lot more benefits than companies have provided in the past. There's increased costs from, certainly in the short term, on the 100% coverage of preventive care. Yes, that's good, but it'll increase costs at least in the short term, hopefully reduces costs in the long term. The essential benefits package is fairly complete. There's actually some new items in there for coverage. especially for pediatric dental care as an example, that increase the costs. And so I think employers are going to be challenged under these programs to find ways to lower their overall cost, even though they're picking up additional benefits and costs in certain segments, which means that healthcare consumerism has a whole different motivation for folks to move into healthcare consumerism and to engage employees in healthy behaviors to kind of offset or compensate for those. And I think within that is how do you bring in these new concepts to a population maybe that hasn't had those before? At what point do you start? You start with the first generation. I always encourage at least start with second generation concepts and then build out from there. The whole idea of rewards and incentives, however you're going to be doing them, whether it's in account-based plans or whether it's employee contributions or changing your deductible or cost-sharing features, many employers would have right away. And so it may take a year or two for them to go from more understandable rewards and incentives that are either dollars or rewards and incentives that are points that convert into certificates, American Express cards, theater tickets to take as rewards and incentives. Employers who have been down this road started in those areas and found out, yeah, they were well accepted, but they really didn't get the behavioral change that they were hoping. And so they moved more and more as employees got comfortable with the concept of rewards and incentives after selecting the plan, the changes that happened during the year. They moved more towards the health status and outcomes rewards.
Really interesting question coming from one of our attendees, and you talk about it as part of healthcare consumerism, and that's the issue of transparency. And I think one of the questions here is that, what do you see as the likelihood of having real near future is a key term?
Well, I don't even like the term transparency. Transparency you can argue about. If there's data out there, let's say on hospital error rates, a hospital can say, I'm sorry, that's proprietary. I don't have to share that. That's about how I operate and what I'm doing internally. I really prefer the term right to know, because if employers or employees start talking about, you see, I have a right to know what your error rates are. I have a right to know what your complications, what your blood clot rate is at the hospital. So I think as we move away even from that term transparency into the concept the quality and outcomes and costs, that will be much more successful. The reason why that is one of the weakest areas is because too many people are holding all those cards close to their chest. We'll make them show it first. I'm not going to show mine until they show theirs.
I'm showing my contracts first until they show their contracts.
So real price transparency, we're seeing some of it in a couple. We see it at the most basic level. You can walk into the mini clinics these days, and you'll see a price schedule. Some of the Walmarts or Targets are moving in service. You want a certain checkup, you get a certain price. You want an immunization at a certain price posted. Where we're seeing it develop even on the higher end at the hospital side is those hospitals that have been involved in or maybe exposed to through even competition, the bundling of charges at the that other countries do bundle services, and they have stated prices, and people know if they're going to go to Costa Rica for dental care what the cost of an implant specifically is, where you don't always know. If you ask your doctor, he's not going to tell you, or your dentist, because he's got 12 different contracts, and if you're a self-pay, he doesn't even know what contract. So I think it's a natural pressure, and we're also going to see it because of the ACA starting to look at the Accountable Care Organization, bundled pricing, package pricing. In some ways, we'll get back to capitation, so a little bit maybe back to the future in some of those reimbursement arrangements, but it'll all get down ultimately to much more price transparency than we have today. Am I optimistic we're going to have the same we would have in other retail markets. I don't think that's going to happen real soon because of the hesitancy that many have to disclose their actual prices.
Well, it actually ties back to your generations too, does it not? Is that the more educated employee consumer we have, the more pressure is going to be, information, the transparent information.
You don't change your prices in the normal business world outside of healthcare until you lose customers. CEOs, the business leaders of that organization start to say, well, is it our service, is it our price? And they're very sensitive to all those issues. Whereas in healthcare, everybody's so busy and filled up, hospitals aren't necessarily price competitive. They should be, and we're getting there more and more. I think we will see more transparency in the medical tourism that's occurring, but the internal to the United States tourism, if you will, or medical travel from one part of the country to the other part of the country where you get the same service, same quality, but at a lower cost. And the cost across this country, the variance in costs from the east to the west coast can be very, very different than other parts of the country.
Well, listen, we're about at the end of time, and I think we've got most of the question answered. I want to remind the audience again, there was a question coming, where will the archives be? The archives will actually be on theihcc.com, which is our institute website, under the events tab and webinars. And those that are will receive a direct link to the recorded archives. Ron, thank you again for your participation.
Thank you.
And our audience, thank you very much, and look forward to the Institute website. Have a great day.